We are very excited to present our second annual webinar series on transition planning for youth and young adults with learning, intellectual, and/or developmental disabilities. My name is Ida Barisi. I'm here along with my colleagues who helped create and organize these webinar series, Dr. Erin Rivelis, Dr. Monica McQuaid, Dr. Rosa Sejo, Miriam Franco, and Marcel Hatcher. So thank you so much for all your help with this webinar series. We all work at the Rose F. Kennedy Center, Children's Evaluation and Rehabilitation Center at Children's Hospital at Montefiore. Today is the first of our three-part series. The next dates are July 21st and July 28th. They are held on Wednesdays at 12 o'clock. Remember, each webinar will be presented in Spanish immediately following the English presentation. So I'd like to go over some housekeeping. The webinars will be recorded. As soon as the recording is available, we will be posting it on our website, but we will also be sending it to all who registered with an email address. Please stay on mute. We really want to minimize distraction to any background noises so we can hear our speakers. We may not have time for questions and answers, but please, we encourage you to put the questions in the chat box. You can also email us at the email address that was on the flyer, the Search Transition Fair at montefiore.org, but we will also put that email address in the chat box and we will respond in the coming days. At the end of the webinar, there will be a short survey available in both English and Spanish. Please complete the survey as it tremendously helps us coming up with topics for future webinars. We will put the survey link in the chat box, but you'll also get an email, the email that you use for registration with the survey link, as well as the contact information for our presenters for today and other resources that we have put together, including tip sheets and a terminology guide. If you did not register, but you are here in attendance, again, please either message me directly through the chat feature or with our Search Transition Fair at montefiore.org email address that was on the flyer. Again, we will put it in the chat box. So we can at least have your email address and we'll send you the resources and the survey. So without further ado, let me present our first speaker. So before that, our topic today is entitled Making Informed Decisions Regarding Medical Issues, Medical Transition to Adult Services. So our first speaker is Dr. Lynn Davidson. Dr. Davidson is an attending physician in the Division of Academic General Pediatrics at Montefiore and an assistant professor of pediatrics at Albert Einstein College of Medicine. She is a clinician educator whose clinical focus is on treating children with special healthcare needs, with interest in treating those with autism, attention deficit disorder, cerebral palsy, medical complexity, and improving transition of youth with and without special healthcare needs to the adult providers. Her research focuses on healthcare transition. She is board certified in pediatrics, neurodevelopmental disabilities, and developmental behavioral pediatrics. Welcome, Dr. Davidson.
Thank you very much, and thank you, Ida, for that lovely introduction. And I thank the organizers for inviting me to share what has become a passion. I would like to share my screen. Let's see if we can do this. Hold on. And I'm going to, do you see my slides? Great.
Yes.
Okay, perfect. Okay, so let's get started. I'd like to start with what I want you to learn, or at least the take-home points. At least then I know you've heard what I've had to say, and we'll go in detail and come back to these take-home points at the end. So here are your take-home points. Healthcare transition planning is very important. I think you're here, that's obvious. You're interested in this area. We need to start the planning early at 12 to 14 years of age. We're going to talk about some tools that help with the planning, the importance of being independent, encouraging independent, depending on whether you're a young adult or whether you're a parent or guardian of a young adult, and importance of encouraging knowledge and safety, and the importance of a team approach. This cannot happen as an individual. It's very helpful to be a team. So let's talk about what is transition. This is from, the quote at the top is from the literature. Transition is defined as the purposeful planned movement of adolescents and young adult with chronic physical and medical conditions. And I often talk about those without physical medical conditions, from child-centered to adult-oriented healthcare systems. And in essence, transition is the preparation, and transfer is what we call the warm handoff to the adult-oriented medical provider. What could be a nurse practitioner, that could be a family practitioner, that could be an internist. Why is this important? And I think many of us are aware that youth have improved outcomes if we do the appropriate planning at whatever stage that youth is. So it decreases medical complications if we plan. We'll have better continuity of care, we'll have lower costs to the patient and to society, and we'll have better adherence to medical therapies and a better experience for the patient. Here's from the literature. This is a survey of clinicians to see what they thought, and this is not parents or patients, what they thought were indicators for successful healthcare transition. And that is that the patient family trusts the adult provider, there's ongoing continuity of care, there is if the patient is capable, they are able to do disease-specific and self-management skills. The patient doesn't use the ER for primary care. The patient family is satisfied with the transfer of care, and that patient maintains and improves their healthcare outcomes. So that's from the provider point of view. When should we start the preparation? And there is guidance out there. There's literature that I'm going to focus on the literature, but from the American Academy of Pediatrics in combination with the American Academy of Family Physicians and the American College of Physicians. But there are other disease-specific literature as well as individual patient-specific guidance. And they all talk about starting the transition process, the preparation, at 12 to 14 years of age. But why start so early? That sounds so early, because the planning starts early. That's not when we're sending our patients to the adult providers. And we're sending our patients to the adult providers, for the most part, at 18 to 21 years of age. We start early because it's a time-consuming process, and that there are barriers for the families as well as the medical providers. And we'll go into detail what the process entails. So here's a timeline from a group called Got Transition. And if any of you are interested in more information on this area, Got Transition is a fabulous group that provides help for patients, families, and providers on healthcare transition. But this is one set of ideas of a timeline, starting at 12 to 13, about a patient learning about his or her healthcare condition, the medications, their allergies, helping a patient who's capable to start asking the doctor about questions for their health and being involved and a consumer of their own healthcare needs, shows that they have better interest in what's going on and they prepare better for that transfer. At 14 to 15 years old, we encourage those patients who are capable to talk to their doctor alone for part of the visit, to talk about the transition process, which is really just how do we prepare our knowledge, patients' knowledge for that transition process, and learning more about their own health, about what to do in an emergency and what their medical problems are. So this is the beginning of the timeline, starting at 12 to 15, and it's really dependent on that patient's capabilities. At 16 to 17, it's time to start talking to the doctor if that patient is capable of having some privacy and what are the rules for privacy once they turn 18, working with their doctor to make a medical summary or to start to make a medical summary. Again, seeing the doctor alone if possible and if the patient is capable. And at 18 to 21, and I know there are seminars next week and the week after about these issues, a patient, if there isn't legal guardianship put in place, at 18 to 21, that patient is legally an adult. Those parent or guardians should start thinking about way before 18 about getting legal guardianship. Again, there's going to be a whole talk about this, and finding an adult medical clinician to make that first appointment and making that first appointment for that adult provider. So we're going to go into details about transition steps, and this is from the parent guardian point of view. So the previous slides were more from the patient point of view. These are for a parent guardian, and I know we have a mixed audience here of both patients and guardians. It's important to know core knowledge and skills, assessing the level of independence for that patient and for the patient themselves to understand what they know and what they should know about their medical condition. Again, I'm talking about encouraging independent functioning to the best of a patient's ability, and the importance of working with a team in order to enhance that healthcare transition. So that could be your medical provider, your social worker, coordinators, their healthcare coordinators, or your Medicaid coordinators, and your teachers to see what are the best ways to enhance independence and functioning. And then working with the medical clinician to create a medical summary to find an adult medical provider. And I'm going to go into a little more detail about this. So what's core knowledge? Core knowledge is medical knowledge of your own or your child's condition, so that that child can communicate their medical knowledge, knowledge of medications, enhancing current activities of daily living. We'll go into detail of that. Knowing what skills a patient already has and what skills that patient or person needs to learn, and what are our strengths and weaknesses as a patient or as and what can we do to enhance those strengths. So this is an example of a tool for parents, and there is a similar tool that should be filled out by the youth or young adult. And this focuses on how am I ready as a patient to move on to the adult medical practices. And this is the first part of it. And this is from the American College of Physicians. There's also similar kinds of forms like this at the Got Transition website, which I talked about. And this talks about who's making decisions, how much of care can be done by that young adult themselves, if you're the young adult, how much help you need, and as a guardian, how much help does your child or young adult need to move forward into independent living. This is the second page, which looks at medical needs, but it also looks at access to care. And I'm not going to go through this completely, but this is a tool that can be used for a parent or a young adult to fill out and figure out, what do I know? What do I don't know? What do I need help with? What do I have to learn? And this is used in my practice. We use a form like this at starting at age 14 in order to help prepare our patients towards healthcare transition and transfer to the adult medical world. So how can we encourage independence? If you're a guardian, you want to make sure that your youth or young adult has maximized their activities of daily living. If they can dress or bathe themselves alone, they should be encouraged to do so. How does one get help in an emergency? Are simple ideas of things that everyone should be pushing their youth for, their patients for, and if you're a young adult, to enhance your own independence. Important to know the name of the medical condition, know the names of medications. And I write here, photograph medication labels is an easy way to remember medications, particularly since some of the names are quite complicated. We talk about in education, the elevator speech. And I just want to go over, every patient should have their elevator speech. And it includes, depending on their capability, here's my name, here's how old I am, here's my medical problems, here are my medications, here's what I understand of my medical condition. And if an elevator speech is impossible, I'm going to go later on how you can put that information on a phone, a cell phone, so that you can actually show a medical provider the information if you're not able to communicate that verbally. Here it is. So this is on the iPhone. If you have an Android, there are instructions on GAT Transitions website in order to look on how to do it. And this has basic medical information. And this is a medical history that you can show an adult provider, or you can refer to yourself in order to communicate medical information to a medical clinician. And this can be used for medical information in the emergency room and for an adult provider at transfer, or you can use it for your pediatrician when you're going to see your pediatrician. And why? The more you can have a young person, an adult, communicate their information, the better it is. And this is called the GLAD model. It's from the Florida HATS program. It's a transition program. And it talks about how teaching individuals developmental disabilities how to communicate with the doctor, which is essential. And it talks about GLADD. So the G is give information, and that's your elevator speech. A patient should be able to do that elevator speech when they're talking to their adult provider. They should learn how to listen and learn and use body language to show a medical provider that you're listening, because that's very, very important. Learn how to ask questions. If you don't understand what the medical provider is, teaching individuals to make sure that it's okay to ask questions and to help with the medical plan and be part of that medical plan. And doing your part, which is the D part, is learning as best as one can, or using a cell phone as tool to have that medical information available to that adult provider. I often, when I talk about healthcare transition to clinicians, I talk about ongoing healthcare and not forgetting those important things. And as an individual, a patient, these are important pieces of your healthcare you want to think about that sometimes are left to the side. So not to forget about important immunizations, and I'd like to emphasize the newest immunization on the block, the COVID vaccine, but all vaccines are important. Nutrition, how to keep us healthy with nutrition, exercise, thinking about high risk behaviors that we should be avoiding, but that the medical provider should be asking about high risk behaviors, about mental health concerns. And I'm going to emphasize something that's often left out, and that's sexuality. I'm just going to talk about it for a second. Because safety and sexuality is an important part of healthcare transition, about independence and growing up, that sexuality is a human right for all. Sexual education should be added to all the individual education plans in the schools. Sometimes it is, sometimes it isn't. The importance for parents and guardians, and again, this is a mixed group, to talk about and prepare their youth for pubertal changes. And again, these are just a few books out there that are available Some of them you can download. So for the Vanderbilt Healthy Bodies, you can download from the internet. It includes both a parent guide and a patient youth handout. But there are a variety of books out there at a variety of levels in order to help patients be prepared for safety and sexuality as they become adults. So when you're starting to get ready closer to the 18 to 21-year-old age group, we recommend that with your pediatrician and your families, you find an adult clinician. And that could be somebody that another family member uses, somebody that your pediatrician recommends, somebody that your insurance pays for. You want to work with your pediatrician. And when I say pediatrician, some people have pediatric nurse practitioners or family medicine people about making a medical summary, something that you could download or photograph onto your phone. It's very important when your clinician, your pediatrician makes a medical summary that the patient or the parent reviews that medical summary to make sure it's accurate and has the right information. And I recommend that patients with their parents write a summary about how best that young adult communicates, how best to approach the exam, and the special talents and strengths of each individual, since we all have special talents and strengths. This is an example, and this is the top half of a medical summary form. It should be portable. This comes from the American College of Physicians. Again, GOT Transition has them. Those who are in the Montefiore Einstein system, there's actually a portable medical summary in the EMR, in the electronic medical record, and it includes a variety of very important things, including things like functional levels and nutritional levels, sleep issues. I'm going to just show you, I don't have the second page, but all kinds of history, medical history, important medical history should be on that. Including emergency contact forms. This is something that can be downloaded from the internet. You can Google AAP, the American Academy of Pediatrics emergency form, and this should be used if you don't have a medical summary or prior to transfer to the adults, to have information to share with an emergency room, particularly when you're traveling or when you're not necessarily at your medical home base. So I'm going to wrap up with final thoughts. Hopefully there's some questions. Healthcare transition planning important. I hope I reflected that in this quick presentation. Starting early, if you can, is important. Just because it's very time consuming. I've talked about a couple of tools that are helpful, including the ones on your cell phone. Photographing medications are really helpful in order to communicate with adult providers and pediatric providers. The importance of maximizing independence so that patients are better consumers of their medical care, and importance of a team approach. And I probably have lots more that I could share, but I'm going to go on to questions and other thoughts.
Thank you so much, Dr. Davidson. That was amazing. I took a lot of notes. And so would you be willing to share your PowerPoint for those who registered? Because there were a lot of great information on that.
Absolutely, absolutely.
Beautiful. In terms of the chat, so right now we don't have any questions, but maybe after Dr. Siasoco completes his presentation, maybe we'll have some more questions then. All right. So thank you for unsharing. All right, thank you again. So I am happy to introduce our next speaker, Dr. Vincent Siasoco. He is a board certified family physician. He is an assistant professor in the Department of Family and Social Medicine and Department of Pediatrics at the Albert Einstein College of Medicine. Dr. Siasoco is a director of primary care at the Rose F. Kennedy Children's Evaluation and Rehabilitation Center at Montefiore Medical Center. His focus is on caring for those across the age span with intellectual and developmental disabilities. He is a board member of the American Academy of Developmental Medicine and Dentistry, clinical director for Special Olympics, and chair of the Special Olympics New York Health Advisory Council. Welcome, Dr. Siasoco.
Good afternoon. Thank you for having me. Hope you can hear me okay. So, and thank you for the warm introduction. So I'm just gonna give a brief summary of what I'm gonna be talking about. So first off, I'm gonna give an oversight of adult care, just kind of give a broad overview. So as a family physician working at the Rose F. Kennedy Center, I work at the adult primary care clinic. So I'm on the receiving end of those patients that Dr. Davidson transitions for adult care. So giving just a brief oversight, talk about disparities in care so that families and guardians and providers also understand some of the challenges that we that you may or may not know. Also barriers to care that families and guardians and providers unfortunately face. I'll also go on to talk about co-occurring, commonly seen conditions in those with intellectual developmental and learning disabilities. And afterwards, I'll summarize to talk about how we can ensure proper communication and coordination to ensure that that individual that is being transitioned from the pediatric end to the adult end gets the highest quality of care. Next slide, please. So disparities in healthcare. So before I start talking about this, just to kind of give a brief overview, over the last several years, there have been different studies on the adolescent to adult population, on those with developmental disabilities, intellectual disabilities, learning disabilities. And it's been shown that nearly 2/3 had 2 or more co-occurring chronic conditions in this population, be it obesity, hypertension, diabetes, mental health needs. Studies show that more than 40% of individuals with developmental disabilities, learning disabilities, intellectual disabilities were diagnosed with 4 or more chronic conditions in addition to their disability. It's also important to note that typical aging for the population is not typical aging such as you and I. We are not accompanied by high rates of medical and functional problems until about the average age of 70 to 75. However, if we are talking about an individual with a developmental disability, these problems can present 20 to 25 years earlier than somebody without a disability. So it's important to note some of these challenges, these conditions that occur in this population. So when you talk about disparities in healthcare, unfortunately, those with disabilities experience difficulties or delays in obtaining adequate healthcare. Studies have shown that individuals have not had a mammogram in the past 2 years, have not had a pap smear in the previous 3 years, have not had an annual dental visit. They're more prone to having high blood pressure, experience symptoms of psychological distress. They tend to receive less social emotional support and tend to be overweight or obese. Next slide, please. So unfortunately, these are barriers to care that most of us on this call are very aware of. And it's barriers that impede the care of these individuals, not only from the family, but also from the provider end. So when we talk about stereotypes and assumptions, unfortunately, there's no concrete medical training in medical schools on how to take care of somebody with an intellectual developmental disability. So as we know, not everybody in a wheelchair has an intellectual disability. Not everyone with an intellectual disability can speak for themselves. Families, guardians, of course, know that. Providers should know that, and they need to know that. Physical, architectural barriers are still commonplace, unfortunately. Studies have shown that only 1 out of every 100 medical clinics has a wheelchair scale. So going back to what Dr. Davidson was saying is to identify that adult provider that will take care of that individual. They need to know who is the provider, what's the environment that this individual is going to be going into. There was a study done several years ago at the Baylor College of Medicine, and they were looking at about 1,000 females, and half with a disability and half without a disability. and they did surveys for those in the study. And one of the questions in the study was, what was the most common reason for not getting annual women's health care, cervical cancer screening? Why did they not get that? And the number one main reason wasn't because, well, the doctor wasn't caring, they couldn't get an appointment. It was the main reason they couldn't get on the exam table. They couldn't get out of the wheelchair into the exam table, so they actually got lost to follow up. So, you always want to take into consideration other aspects, not just the physician, but also families of where their individuals are going to be sent to. Communication, unfortunately, is an issue. Insurances are an issue. Those with Medicaid may not have as many options if they had commercial. Lack of medical education training. I mentioned that earlier, that unfortunately in medical school right now, we're doing everything we can to ensure that medical students and dental students and healthcare providers for the future get all the training they can, but still more needs to be done. Fancy word here at number 7 is called diagnostic overshadowing. So it basically occurs when all the change or unusual behaviors are attributed to the intellectual disability, or conversely, everything is attributed to a psychiatric disorder without due acknowledgement of the impact of one or the other. A lot of fancy words, I know it gets a little confusing, but basically an example of this is, for example, say there's an adolescent or a young adult with an intellectual disability. Maybe they're nonverbal, they live in a group home. So now they're being evaluated because somebody has identified that all of a sudden they're banging their head. They can't verbalize, they're having behavioral outbursts, they're not really sure what's happening. So the patient is sent to a psychiatrist and diagnosed with a psychiatric disorder, is now prescribed medication. When in reality, when the patient was seen by the physician or the dentist, it turns out because of the communication challenges, they couldn't express that the pain was really, the behavior was really due to a pain that was in their mouth, but that's how it was being expressed. So one of the things that we always want to ensure providers and healthcare clinicians avoid are diagnostic overshadowing. So that could be a big barrier to care, especially for families who don't know what's going on with their loved one. Next slide, please. So I'm going to talk about common conditions that you see in patients with developmental disabilities. And as Dr. Davidson had said earlier, other aspects of care, including nutrition, immunizations, exercise, high risk behavior, sexuality, should all be addressed by that adult provider taking on the care of that young adult in their practice. And it should be as interdisciplinary as possible. So I'm a family physician, so it sounds cliche, but it really takes a village. I cannot take care of a young adult with an intellectual disability without working with their dentist, without working with their psychiatrist or their psychologist, or even their developmental pediatrician. It all takes all of us together to take care of that young adult, especially when they transition into the adult world. Intellectual disabilities, again, not everyone with a developmental disability may have intellectual disability. It's important for providers to know and important for families to convey that to the new provider. Epilepsy, unfortunately, this is a common occurring condition in those with disabilities. So the medications that these individuals are on, it's very important to note. Make sure, as Dr. Davidson was saying, is to write that down. A medical summary is so key for adult providers such as myself, who have a new patient in front of me who may not be able to speak for themselves, but when mom and dad can present that information to me, I can also educate them on not only the benefits, obviously, of the medication, but also look out for certain side effects that seizure medications may cause. It can affect the oral health, it can affect behavior. So, from a primary care perspective, we want to make sure that the seizures, of course, are under control. They're getting good care. They're being followed by an adult neurologist when the transition occurs, but also from our end is making sure that the medications that they're taking is done in a safe manner and is being monitored properly. Now, gastrointestinal disorders, then one of the most common conditions that I see as a primary care physician across the board is constipation issues. So we want to make sure that mom and dad are keeping us in the loop in terms of how their young adult is doing, how they've been, what medications are on, any issues that we need to be made aware of. Fecal impaction is unfortunately something that is seen in this population, but it's also the most preventable cause of hospitalizations. So again, understanding the individual, knowing the medical conditions and the medications that were used and are being used is very helpful. Reflux disease is also an issue. And unfortunately, with these two conditions, be it constipation or reflux disease, if the individual is nonverbal, they may present as a behavioral issue. So when they see me, it's always good for the family, the guardian, to make me aware of, so this individual may be acting up, but maybe because they didn't have a bowel movement for X amount of days. So all that information is very key. Pulmonary disorders. Unfortunately, aspiration pneumonia is an issue with some of our patient population, especially those with cerebral palsy that have issues with swallowing, with dysphagia, meaning difficulty in swallowing. Some of the individuals, be it young adults, adolescents, children, they may be on certain diets, pureed, chopped. So all of that information is very important for us to know to prevent conditions such as aspiration pneumonia. Urinary disorders. So, for example, you or I, if we have a urinary tract infection, we may say, it hurts when we urinate, we may have back pain, we may have abdominal pain, but somebody, for example, with spina bifida may not present all that. They may not feel that. So they just present with a strong urinary odor. And that is the key, that they are developing a UTI. Sometimes my patients know more than I do, and they're the ones telling me, this is what's happening with me, and I know that's a red flag. We'll start the treatment if need be. So I need to listen to them as much as they need to listen to me. And if the patients can't communicate, again, that's where the families and caregivers are really important to convey that. Osteoporosis and osteopenia. So checking for vitamin D levels is very important with this population. I see that, unfortunately, if they don't get out a lot, they don't get in the sun, sometimes their vitamin D levels are very low. So they're at an increased risk for osteopenia or earlier onset osteoporosis. Again, going back to the medications, some medications also increase the risk of fractures at an earlier age, such as those that prevent seizures. So again, something to consider. And also, again, going back to the medications, it's very important to let your provider know what medications you're on, what they've been on, and also what tests have been done in the past. So when they do transition to adult care, when was the last vitamin D level done? When was the last DEXA scan done? Next slide, please. So I mentioned behavioral, emotional, psychiatric disorders. Unfortunately, those are conditions that are seen with our patient population. So with any type of medication, it's important to note what they're on, what are the side effects, make sure that they're being monitored. Families, guardians should know who is the psychiatrist, who's the psychologist, who's the primary care provider, who's ordering the drug levels, who's ordering the labs. It can get very confusing. But that's why it's also very important, again, put together a medical summary and also put a list of questions together when you see that adult physician for the first time. I know as a family physician being involved with this population for over 15 years now, I've gotten to know wonderful pediatricians who probably take care of the individuals a little bit longer than most would, going through 20s or 30s. So by the time they transition to me, they're not 21 or 22, which would be perfect. But in reality, sometimes they're a little bit older. So sometimes the pediatricians start seeing certain conditions. Other conditions, obviously visual, hearing, speech impairments. Always important to let the caregiver know if there are any types of impairments aside from, say, intellectual, learning, or developmental disabilities. There are a lot of times where I may have somebody who's hearing impaired but refuses to wear their hearing aids. So unless somebody informed me of that, I wouldn't know. So I think that's very key as well. Visual speech impairment. Sometimes individuals, if you have a speech board or if you can read lips, use sign language, I think that is very important to let the caregiver know. Pain syndromes is very important, and it can be very challenging also to know who's in pain and who's not. We do as best we can to use a type of pain scale to see if they're doing okay, and that helps. But again, the families, the caregivers, group home staff, sometimes they know the individuals, and that information can be conveyed to the provider. I think, and that's very key. Something as simple as, for example, when I do an initial eval on a woman, a young adult, I'll always ask, so when are their menstrual periods? How do they deal with cramps? Something as simple as monthly cramps that somebody's undergoing may take ibuprofen or Tylenol to address that. We want to make sure that something as regular or as routine is being addressed, so that if they do have pain, their pain is being addressed. Somebody with cerebral palsy may have severe spasticity. We want to make sure that they're getting physical therapy, occupational therapy on an ongoing basis, not just when they're children, but it should continue when they get into adulthood. Oral health. Oral health is very key. I feel when I'm seeing a patient for primary care, I'm thinking about uh, when are they going to see the dentist? When are they going to see the eye doctor? When are they going to see their gynecologist? Unfortunately, individuals, especially young adults and adults, are at an increased risk for dental caries and other dental diseases. Poor oral health care can lead to bacterial infections in the bloodstream, causing heart problems, neurologic problems such as stroke. They can cause lung problems such as pneumonia. So again, it's putting all the pieces together that can be overwhelming for families and caregivers, but it's important to know all of that. So this way, the physician, the primary care physician, the nurse practitioner can communicate, ensure that all the care is being provided to the individual. Women's healthcare. This is very important. As Dr. Davidson was saying, talking about sexuality, both for men and women, but women's healthcare is very important. When you're talking about immunizations, when we talk about immunizations these days, it's all about the COVID vaccine. Of course, that's so important. But routine immunizations, such as the HPV vaccine that you can get as young as 11 or 12, some young adolescents may not have had that discussion, or vice versa. Their pediatrician may not have had that conversation with them to get that vaccine or offer it. So that's something to be made aware of. What type of immunizations should they be getting? What conversations did you want to have with that adult provider to see if they could still get it? The HPV vaccine can be given to somebody in their 20s if need be. Cervical cancer screening, of course, is very important, as well as breast cancer screening. Dementia. This is very important to note also for families and caregivers. There are certain conditions that cause certain people to be more prone to, say, an earlier onset dementia. For example, those with Down syndrome may present with earlier onset dementia than in the normal population. So pediatricians wouldn't be necessarily aware of that, but that is something to be seen as they transition into adulthood. Next slide, please. So ensuring communication and coordination of care. So everything that Dr. Davidson was saying, the medical summary, the transition readiness tool, the elevator speech, GLAD model, that is so valuable and so useful for adult providers such as myself. So when I'm seeing that individual for the first time for a physical exam and getting all that information, getting that elevator speech from mom or dad or that loved one is so helpful to put all the pieces together. It's not only important to know, well, do they have ADHD, Down syndrome, autism? That's key. Their medications, of course, is key. What are the allergies? But also the individual themselves. So, for example, what are their likes and dislikes? So if I say wanted to get some blood work on them or get an EKG, what would be the best way for me to approach the individual? Would it be to maybe have a couple of visits, maybe set up certain times during the course of the day that they can be seen? What type of supports do they have? So all of that is very important. So effective communication, understanding whether the individual is verbal or nonverbal. Obviously, the healthcare provider should always talk to the individual first and foremost, make eye contact. But there are times where the family, the guardian will have to speak on behalf of the individual, and that's important for the provider to know. Identifying the intellectual and physical disabilities. Nobody wants to make any assumptions about anyone. So it's very important for the provider to be made aware of what that is, what the disabilities are, and what needs to be done. Type of home environment. There are individuals that live with loving families in the community, and there's some that live with wonderful group home staff. So it's very important to know, well, I'm here with my child, but during the week they live at a group home, or they come home on the weekend. So it's very important to know what support they have, be it in the community, in a group home, just in the environment in general. In the event that they do get hospitalized, and of course, first and foremost, nobody should be going to the ER if they don't have to. But unfortunately, things do happen. And if they do get hospitalized, it gets into the ER, effective discharge planning and scheduling and follow-up preparation of appointments is very crucial if that should happen. So again, it's important to know who the primary care providers, who the specialists are. And I think with that medical summary, that will be very helpful. And that is, of course, going from the pediatric age. And then when they become an adult, that medical summary will be even more important because more information will be added on to that medical summary. And the physician role in promoting care coordination within team, agencies, pharmacies, transportation. I think, and I know it can get very overwhelming for families and guardians and even group home staff where there's different, here's a primary care provider, here's a dentist, here's a specialist, and you get very overwhelming. So it's important to understand who is doing what, who the primary care provider is, so that when the care gets transitioned to that primary care provider, they can be that source of information and support for the families and the guardians to give guidance and a better understanding of what's happening at all times. And I think that is it for me. Thank you very much for having me here.
That was wonderful. Thank you so much, Dr. Siasoco. So we don't have any questions in the chat box now, but we do get a lot of emails, usually the day of and a few days after, and we'll be more than happy to forward those to you so you can help us answer that. Thank you both. Those were powerful, very powerful talks. And I learned a lot. I took a lot of notes, so thank you so much for that. So let me share, let's get back to our screen here. Let me see if I shared it. I want to get to, oh, hold on. Screen share has stopped, is closed. Okay. Thank goodness that Miriam is sharing the screen for us because it always takes me a while to do that. I apologize. I want to get the slide back up again. Just for some closing remarks. Okay, here we go. Let's start the slideshow and let me share this. I apologize, everybody. Here we go. All right. So, let me scroll down. Here we go. All right. So again, I want to thank you, Dr. Davidson, Dr. Siasoco. That was amazing. I also want to thank everyone for attending our webinar today. So we'd like to draw your attention to this flyer. This is Spark. It's an online research partnership with the goal of speeding up autism research to understand causes and treatment for autism. There is no cost to join Spark. It's easy, can be done entirely online at the website that you see on that flyer there, but you can also choose to register in person with the Rose F. Kennedy's Children's Evaluation Center here at Montefiore. And we will put the email address when we send the flyer to you. Don't forget, after this webinar, there will be a survey. Please, we're going to put the link in the chat box, but we will also be emailing the link to everyone's email address and all of those, even though you didn't register, but you're here today, we will send you that through your email. I want to remind you that the Spanish version is right after this webinar. The next webinar is next Wednesday, July 21st. And that's, the topics are special needs planning, guardianship, and supported decision-making. And don't forget, please email the Search Transition Fair at montefiore.org. That is our email address. We will send you these PowerPoints and lots of other resources that we put together for all our attendees. So we want to thank you again and enjoy your afternoon.